Are you tired of your days and nights being interrupted by constant trips to the bathroom? Or that frustrating feeling of having to go again, only for it to be a weak stream? For millions of men, these prostate and urinary issues can feel like an unavoidable part of getting older. Maybe you're experiencing some dribbling after you think you're done, or a sudden, urgent need to go that sends you rushing to find a restroom. It can mess with your sleep, your work, and your social life, leaving you feeling like you're not quite in control of your own body anymore. And that constant, low-level anxiety, always wondering where the nearest bathroom is, worrying about accidents, feeling like you never fully empty your bladder. It takes a real toll. It's not just physical. It chips away at your confidence and your freedom. A lot of men start drinking less water, which just leads to other problems like fatigue and constipation. Or they start avoiding things they used to love, all because of fear or embarrassment. But the idea that this is just how it is after a certain age, that's a myth we need to bust. You don't have to just accept a decline in your quality of life. But what if you could start taking back control, naturally, right from the comfort of your own home? What if there was a way to strengthen your body from the inside out, getting to the root of the problem without jumping straight to medications or procedures? In this video, I'm going to guide you through the most effective exercises specifically chosen to improve your prostate health and strengthen your bladder control. These are simple, science-backed movements that can make a real, lasting difference in how you feel every single day. We're not talking about some grueling, high-impact workout. We're talking about smart, targeted exercises that put you back in the driver's seat. So stick with me, and I'll show you exactly how. Let's get started. Hello, my name is Dr. James Anderson, and I'm a physical therapist specializing in men's pelvic health. For over 15 years, I've dedicated my career to helping men navigate the exact challenges we're talking about today. I've worked with thousands of patients, from men dealing with the early signs of an enlarged prostate, also called BPH, to guys recovering from prostate surgery. I've seen how tough these urinary issues can be, but more importantly, I've also seen just how powerful the right exercises are. What I'm sharing with you today isn't guesswork or a passing fad. It's all grounded in clinical evidence and years of hands-on experience. We're going to focus on exercises that are proven to help manage the symptoms that come with an enlarged prostate and an overactive bladder. These methods are designed to be safe, easy to get started with, and incredibly effective when you do them the right way, consistently. My promise to you is to give you a clear, simple, and direct guide. We won't just rush through the movements. I'm going to break down each exercise step by step. I'll explain why it works, how it directly helps your prostate and bladder. I'll show you the correct form to make sure you get the full benefit and avoid common mistakes. And then, we'll do them together, so you can feel confident making this a part of your daily life. This isn't a quick fix. It's a real, long-term strategy for better health and a better quality of life. By the end of this video, you'll have a complete toolkit of exercises to help you reclaim control and restore your body's natural function. Before we get moving, it's really important to understand what's going on inside your body and why these specific exercises are so powerful. When you get the why, the exercises stop being just movements and start being intentional acts of strengthening and healing. First, let's talk about the star of the show, your pelvic floor. Picture a hammock of muscle stretching from your pubic bone in the front to your tailbone in the back. In men, these muscles support your pelvic organs, your bladder, your rectum, and your prostate. They're critical because they wrap right around the urethra, which is the tube that urine passes through. When your pelvic floor is strong, it acts like a valve. It tightens to hold urine in and relaxes to let it out when you decide. But as men get older, a few things can weaken these muscles. The aging process itself, chronic coughing, straining from constipation, carrying extra weight, or having certain surgeries can all cause them to lose tone. When that supportive hammock gets weak, it can't do its job of supporting the bladder and controlling the urethra as well. And that's what leads to things like stress incontinence, leaking a bit of urine when you cough, sneeze, or lift something heavy. Now for the prostate. It's a small gland about the size of a walnut, that sits right below the bladder, and the urethra runs straight through it. A very common condition in older men is benign prostatic hyperplasia, or BPH, which is simply a non-cancerous enlargement of the prostate. As the prostate gets bigger, it can start to squeeze the urethra, and that squeeze is what causes all the classic BPH symptoms: a weak stream, trouble getting started, feeling like you didn't quite empty the tank, and having to go all the time, especially at night. So you can see we have two issues that are connected: a pelvic floor that might be weak, affecting your control, and an enlarged prostate that might be affecting your flow. This is where exercise works its magic in a few powerful ways. First, by doing exercises like Kegels, you directly strengthen that muscular hammock. A stronger pelvic floor gives better support to the bladder and improves your ability to consciously shut off the flow of urine. This is your frontline defense against leaks and urgency. You're basically retraining your body's own internal valve. Second, certain stretches, especially ones from yoga, help release chronic tension in the muscles around your pelvis. When your hips, glutes, and lower back are constantly tight, it can actually make pelvic pain and dysfunction worse. By gently stretching these areas, you can improve blood flow to the entire pelvic region, which can help calm things down and relieve some of the discomfort from prostate issues. And finally, general physical activity is a huge piece of the puzzle. Regular exercise like walking or swimming helps you maintain a healthy weight. Extra weight, especially around your belly, puts more pressure on your bladder, making urgency worse. On top of that, aerobic exercise is known to reduce inflammation in the body and improve heart health. And studies show these factors are linked to better prostate health and can help you manage symptoms of BPH and improve your quality of life. So, our plan is a three-pronged attack. We strengthen the control muscles, we stretch to release tension and improve blood flow, and we use general activity to support our overall health. This complete approach is what makes it work so well. Now, let's get to our very first exercise. All right, let's put that knowledge into practice. We're going to work through 5 of the most effective exercises for your prostate and urinary health. For each one, I'll first explain how to do it and why it helps. I'll show you the right way to do it and what mistakes to watch out for. Then, we'll do a set together. I suggest finding a comfortable spot on the floor, maybe on a yoga mat or a rug. Wear some clothes you can move in easily. And remember, always listen to your body. The goal here is gentle, consistent progress, not pushing through pain. We're starting with the single most important exercise for regaining urinary control. Kegels directly target those pelvic floor muscles we just talked about. When you do them right, they can make a huge difference in preventing leaks, managing urgency, and even stopping that frustrating dribble after you urinate. The why for this exercise: by isolating and strengthening the muscles that support your bladder and control your urethra, you're building a stronger internal valve that you can operate whenever you need to. This puts you back in conscious control. Step-by-step instructions. Finding the right muscles is the trickiest part at first, and it's where most people get tripped up. Don't worry if it takes a few tries. Be patient with yourself. The identification technique. The easiest way to find your pelvic floor muscles is to imagine you're trying to stop the flow of urine midstream. That tightening and lifting feeling, that's your pelvic floor. Another great cue is to imagine you're trying to stop yourself from passing gas. Squeeze the muscles you'd use to hold it in. You should feel a squeeze and a lift around your anus. For men, another helpful mental image is to try and pull your nuts up to your guts. It's a subtle lift, not a big strain. Confirmation. If you're still not sure, lie down and place your fingertips on the perineum. That's the skin between your scrotum and anus. When you squeeze correctly, you should feel it lift away from your fingers just a little bit. Important note, don't get into the habit of actually stopping your urine flow to practice. Using it once or twice to find the muscles is okay, but doing it regularly can mess with your bladder's normal function and could even increase the risk of a urinary tract infection. Common mistakes and how to avoid them. Squeezing the wrong muscles. A really common mistake is tensing your big surrounding muscles, like your abs, your butt, or your thighs. instead of the small pelvic floor. A Kegel is a subtle, internal lift. If you feel your whole body clenching, you're trying too hard. The fix? Focus on a much gentler contraction. Holding your breath. So many people hold their breath when they concentrate. This actually works against you by increasing pressure in your belly, which pushes down on the very muscles you're trying to strengthen. Always breathe freely. It can help to count out loud to make sure you're not holding your breath. Squeezing too hard. Especially at the beginning, focus on good technique, not brute force. A huge squeeze usually just engages the wrong muscles anyway. Start with about 30% of your maximum effort to really feel the correct muscles working. Let's follow along together. Find a comfortable position, lying on your back with your knees bent. And feet flat on the floor is usually the easiest when you're starting out. Ready? Let's begin. Gently breathe out, and as you do, imagine stopping your stream of urine. Squeeze, and lift those internal muscles. Hold that contraction. 1, 2, 3, 4, 5. Now, slowly and completely relax for a count of 5, 4, 3, 2, 1. That full relaxation is just as important as the squeeze. That's 1 rep. Let's do it again. Squeeze and lift. 1, 2, 3, 4, 5. And fully relax. 5, 4, 3, 2, 1. Are you breathing normally? Make sure your stomach and butt muscles are staying soft. Again, squeeze and lift. 1, 2, 3, 4, 5. And release completely. 5, 4, 3, 2, 1. Really feel that difference between tension and total release. Let's do 2 more. Squeeze and lift. 1, 2, 3, 4, 5. And relax it all down. 5, 4, 3, 2, 1. Last one for this set. Gentle squeeze and lift. 1, 2, 3, 4, 5. And a full, complete relaxation. 5, 4, 3, 2, 1. Excellent. That was 1 set. The goal is to eventually build up to holding the squeeze for 10 seconds. Doing 10 to 15 reps in a set and aiming for 3 sets throughout your day. But start where you are. Consistency is so much more important than intensity. The bridge pose is a fantastic move because it wakes up your pelvic floor and strengthens your glutes and hamstrings. These bigger muscles are part of the support system for your whole pelvis. A strong backside helps you keep good posture and alignment, which takes unnecessary pressure off your bladder. The why for this exercise: when you lift your hips off the floor, you naturally cause a gentle contraction in your pelvic floor. It teaches you to use those muscles together with the bigger support muscles, which is exactly how they work in everyday life. It also helps undo the effects of sitting all day, which can lead to tight hips and weak glutes. Step-by-step instructions. Starting position. Lie on your back, knees bent, feet flat on the floor about hip-width apart. You should be able to just graze your heels with your fingertips. Rest your arms by your sides, palms down. The movement: take a breath in. As you breathe out, press through your feet and arms to lift your hips up. Try to make a long, straight line from your shoulders to your knees. Engagement. At the top, give your glutes, your butt muscles a good squeeze. When you do that, you should also feel your pelvic floor gently engage. It's a great way to feel your Kegel muscles working in a functional way. The hold. Hold this position for a couple of breaths. The release. Take a breath in, and then as you exhale, slowly lower your back down to the floor, 1 bone at a time, from your upper back all the way down to your tailbone. Common mistakes and how to avoid them. Arching the lower back. It's really common to push the hips up way too high, which creates a big, strained arch in your lower back. The fix is to focus on using your core and glutes, and only lift as high as you can while keeping that straight line. Think about reaching your tailbone toward the back of your knees, letting the knees flop open. Keep your knees pointing forward right over your ankles. Don't let them splay out. It can help to imagine you're gently squeezing a block between your knees. Holding your breath. Just like with Kegels, you have to breathe. Exhale on the hard part, lifting up, and inhale as you slowly lower back down. Let's follow along together. Get into position on your back, knees bent, feet flat on the floor. Arms are resting by your sides. Ready? Exhale, press in your feet, and lift your hips up toward the sky. Squeeze your glutes at the top. Hold it here. Breathe in and out. Keep those hips up, but don't overarch your back. You should feel this in the back of your legs and your butt. Now, slowly roll your spine all the way back down. Excellent. Let's go again. Exhale and lift the hips. Pull your belly button in. Gentle squeeze of the glutes. Hold for a moment, breathing normally, and slowly lower back down with control. Let's do 3 more. Exhale, lift up. Check your knees. Are they still over your ankles? Nice straight line from your shoulders. Hold it. Slowly lower back down. 2 more. Exhale and lift. This is such a great way to build the strength that supports your whole pelvic region. Hold and lower down. Last one. Make it your best one. Exhale, lift the hips, squeeze the glutes, engage the core. Hold for 3, 2, 1, and gently lower all the way down. Wonderful. As you get stronger, aim for 2 to 3 sets of 10 to 12 reps. Mid-roll CTA, we're making great progress here, building the foundation for better bladder control and prostate health. If you're finding this step-by-step guidance helpful, please take a second to hit that subscribe button below. My goal is to give you reliable, practical health information to help you live a stronger, more comfortable life. When you subscribe, you won't miss out on future videos that build on what we're doing today. It's a small click that can make a big difference. Thanks for your support. Now let's get back to it. Okay, now we're going to shift gears from strengthening to releasing tension. Cobbler's pose is a seated yoga posture that gives you a great stretch through the hips and groin. For men with prostate issues, this area can hold a lot of tension, which can add to pelvic pain and even restrict blood flow. This pose helps to gently open all that up. The why for this exercise: by gently stretching your inner thighs and groin, this pose can help release pelvic tension. Easing that tightness can improve circulation to the whole pelvic area and may help reduce some of the pressure and discomfort associated with prostate issues. It's a calming pose designed to relax the very muscles that often get stuck in a state of low-level tension. Step-by-step instructions. Starting position: sit on the floor. It can be a lot more comfortable to sit up on the edge of a folded blanket or a cushion. This helps your hips tilt forward. The pose: bring the soles of your feet together and just let your knees fall out to the sides. You can hold onto your feet or your ankles. Adjusting the stretch. You're in control here. To make the stretch more intense, you can gently guide your heels closer to your pelvis. For a gentler stretch, just slide your feet further away. Lengthening the spine. The key is to sit up tall. Think about lengthening your spine all the way from your tailbone to the top of your head, like a string is pulling you upward. The hold. Let your knees feel heavy and allow gravity to do the work. Don't force them down. Breathe deep into your belly. And with every exhale, just imagine the muscles in your hips and groin letting go. Common mistakes and how to avoid them. Forcing the knees down. Please never bounce your knees or use your hands to shove them toward the floor. That's a recipe for injury. The magic of this pose comes from a gentle, sustained stretch. Rounding the back. At first, really focus on sitting up tall to create space. If you slouch, you're just compressing your abdomen. You can add a forward fold later on, but start by finding that length. Tensing the shoulders. Let your shoulders relax down and away from your ears. This pose is about releasing tension, not creating it somewhere else. Let's follow along together. Find your seated position, maybe on a cushion. Bring the soles of your feet together. Ready? Now, let's bring our focus to the breath. Take a slow, deep breath in through your nose and feel your belly expand. And as you exhale slowly, just feel your hips and inner thighs soften up. Let's do that again. Deep breath in and a long, slow exhale, letting go of any tightness you're holding. Don't worry about how low your knees are. Just focus on that feeling of release. We're going to hold here for about 45 seconds. This is an active relaxation. Keep breathing deeply. With every exhale, just give your muscles permission to let go a little more. You might notice one side feels tighter than the other. That's completely normal. Just breathe into it without any judgment. You're doing great. This pose is so good for relieving that pelvic tension that can make urinary symptoms worse. Just a few more seconds. One more deep breath in and a full exhale out. Slowly release. Gently use your hands to bring your knees back toward each other. You can extend your legs out and give them a little shake. Wonderful work. As you get more used to this, you can hold it for anywhere from 1 to 5 minutes. This is another great stretch from yoga that gets into your hamstrings, lower back, and even your side body. When your hamstrings are tight, they can pull your pelvis out of alignment and contribute to lower back pain, which is often linked to pelvic floor issues. This pose helps lengthen all those muscles in the back of your body. The why for this exercise: by stretching one leg at a time, you get a really focused release in the hamstring and lower back. This helps relieve tension that can indirectly put stress on your pelvic floor. The primary benefit is a major muscular release that helps create more space and ease around the pelvis. Step-by-step instructions. Starting position. Sit on the floor with both legs straight out in front of you. Again, sitting on a cushion can really help. Positioning the legs. Bend your right knee and place the bottom of your right foot against your left inner thigh. Let that right knee relax out to the side. Alignment. Gently turn your upper body so that you're facing your extended left leg. Try to line up your belly button with your left thigh. The forward fold. Take a deep breath in and sit up tall. As you breathe out, start to walk your hands forward, folding from your hips, not your waist. The hold. Only go as far as you can without pain. It's totally fine to keep a little bend in your straight leg. You can hold your shin, ankle, or foot, whatever you can reach comfortably. Let your head and neck get heavy, tucking your chin slightly. Common mistakes and how to avoid them. Rounding from the upper back. The goal is to hinge forward from your hips, not just collapse your chest and round your shoulders. To fix this, think about leading with your chest and keeping your spine long as you start to fold. Forcing the stretch. Don't yank yourself into the stretch. That can injure your hamstring or back. Use your breath. With every exhale, just allow your body to soften a little deeper into the pose. Locking the knee. Try not to lock the knee of your straight leg. Keeping a tiny bend in the knee will protect the joint. Let's follow along together. Let's start with your left leg out long and the sole of your right foot against your left inner thigh. Ready? Sit up tall and turn your torso toward your left foot. Take a deep breath in to create some length. As you exhale, start to walk your hands forward, folding from your hips. Stop wherever you feel a good stretch, not sharp pain. Hold your position right here. Let your head be heavy. Now let's use the breath. On your inhale, you might feel your spine get a little longer. On your exhale, you might find you can soften just a bit more. We'll hold this for about 45 seconds. Breathe into the back of your left leg. Feel that hamstring getting a much-needed stretch. This is also stretching out the right side of your lower back. All these areas are connected to your pelvic health. Keep breathing deeply and slowly. Remember, it's not about touching your toes. It's about finding a stretch that feels good for your body today. Just a few more seconds on this side. One more deep breath in and a full exhale. Slowly, use your hands to walk yourself back up to sitting. Excellent. Now let's switch. Extend your right leg out and bring the sole of your left foot to your right inner thigh. Sit tall, turn toward your right leg. Inhale, get long. Exhale, and hinge forward from the hips. Find your spot on this side. It might feel totally different from the first side, and that's perfectly normal. Hold it there. Let your head and neck go. Breathe into the back of your right leg. Every exhale is a chance to let go of tension. This helps create space and flexibility around the entire pelvis, which is so helpful for reducing symptoms tied to pressure and tightness. We're almost there. Keep your breathing steady. Last few seconds. One final deep breath in and a long, slow breath out. Slowly walk your hands back up. Great job. Extend both legs out and give them a little shake. Our final exercise isn't a stretch or an isolation move, but it's one of the most powerful things you can do for your prostate and overall urinary health. Brisk walking. Aerobic exercise is consistently recommended by doctors for managing BPH symptoms. The why for this exercise: regular aerobic exercise like walking helps in so many ways. It helps you manage your weight, which takes pressure off your bladder. It improves blood flow and heart health. And importantly, Studies have shown that men who are more physically active have a lower risk of developing BPH and can lessen their urinary symptoms. In fact, some research has shown that exercise can improve erectile function and sexual health for men dealing with prostate issues. It's a simple, free, and incredibly effective tool. Step-by-step instructions. This isn't a follow-along, but here's your guide to making walking work for you. The goal: aim for at least 30 minutes of moderate intensity cardio on most days of the week. A great target to shoot for is 150 minutes per week. What's moderate intensity? It means you're breathing harder, but you could still hold a conversation. Your heart rate is up. It's not just a casual stroll, it's walking with purpose. Proper form: walk tall. Keep your head up, your shoulders back and relaxed. And pull your core in. Let your arms swing naturally. Land on your heel and roll through to your toes. Consistency is everything. The real benefits come from making it a habit. Find a time that works for you and try to stick with it. Maybe it's a morning walk to start your day, a break during lunch, or a walk in the evening to clear your head. Making it a habit. Start small. If you're new to exercise, don't feel like you have to do 30 minutes right away. Start with 10 or 15 minutes and slowly add more time as you get fitter. Find a partner. Walking with your spouse, a friend, or a neighbor makes it more fun and keeps you accountable. Listen to music or podcasts. This can make the time fly by and turn your walk into me time. Track your progress. A simple step tracker on your phone or watch can be a great motivator. Seeing your progress really helps you stick with it. This final piece of the puzzle, regular aerobic exercise, ties everything else together. It supports the specific strengthening and stretching we're doing and boosts your overall health, which is the foundation for everything. Conclusion and call to action. And there you have it. You just completed a full, comprehensive routine designed specifically to help your prostate and urinary health. Let's do a quick recap. We started with Kegels to strengthen your pelvic floor and give you direct bladder control. We moved to the bridge pose to stabilize the pelvis and make those control muscles work with their support team. Then, we used the cobbler's pose and head-to-knee pose to stretch and release tension in the hips and back, improving flexibility and circulation. And finally, we talked about the huge benefits of brisk walking for managing weight, reducing inflammation, and boosting your overall health. This mix of strengthening, stretching, and cardio is the holistic approach that gets the best results. But here's the most important part. You've got to be consistent. Doing these exercises once is great, but making them a regular part of your life is what creates real, lasting change. Aim to do your Kegels every day. 3 sets of 10 to 15 reps is the gold standard. Try to do the bridge pose and the yoga stretches at least 3 to 4 times a week. And make that daily walk a non-negotiable part of your routine. So when can you expect to feel a difference? Everyone is unique, but with consistent practice, many men start to notice improvements within a few weeks to a few months. Maybe you'll notice you're getting up less at night, or that you have fewer leaks. The changes can be gradual, so be patient with yourself and stick with it. The benefits will build over time. Beyond these exercises, remember your lifestyle matters too. It's important to stay hydrated, but you might try limiting caffeine and alcohol in the evening to help with those nighttime bathroom trips. Eating a healthy diet with plenty of fruits and vegetables is also great for your overall prostate health. You've taken a huge, empowering step today toward reclaiming control over your body and your life. You're not just a passenger here. You have the tools to make a real difference. If this guide was helpful, please support the channel by hitting that subscribe button and turning on notifications. It helps me continue to create in-depth content like this to support you on your health journey. And finally, I'd love to build a community here. Please leave a comment below. Maybe share which exercise you found most helpful or ask any questions you have. Reading about other people's experiences can be so encouraging, and it's a great reminder that you're not alone in this. Thanks for joining me today. Stay consistent, stay positive, and I'll see you in the next video. Thanks for watching. Hit the bell icon for the daily updates. Please do like, subscribe, and share with your friends.